There is no doubt this new guidance will affect all of us. Nightside's Emerald Morrow spent the evening talking to health experts and decision makers about where we go from here.
The key reaction we're getting from a lot of people on this is cautious optimism. Most are happy the science has finally gotten us to this point, but there are still a whole lot of unvaccinated people out there that this could create problems for. But overall, doctors say they trust the science and are ready to get closer to normal with these new CDC guidelines.
They wait until they have dotted all their I's and crossed all their T's and made sure that they've got all the good science. So this is wonderful news.
Dr. Michael Ting, a virologist with USF Health, says the science does support today's decision, but he does also worry about being able to tell who's vaccinated. He also says kids, a group that's not yet vaccinated, might be more at risk because of this announcement. And our local decision makers are also trying to figure out what this means for all of their respective areas.
The county administrator is evaluating that with staff to determine what our best means of protecting our citizens and the employees that work in the building. At this point, nothing has changed.
Other areas like Pasco, Manatee, and Sarasota have already done away with masks in public buildings, but remind people they're always welcome to wear them if that makes them feel more comfortable.
It's a free country. They can still wear them. And I encourage our citizens not to shame anybody if they decide to.
And for me, it's a little bit insane that there are still people out there that are kind of hunkered down, bunkered down in some of these states, waiting for the CDC to allow them to enjoy the freedoms that they're guaranteed just by being born an American. So I just don't see much change here in Sarasota County.
Now, there are some doctors that are not taking the CDC's news so well. One of our local experts, Dr. Eric Feigelding, who's an epidemiologist with the Federation of American Scientists, he had this to say on Twitter, quote, "Once the floodgates open, you can't close them again, especially if variants surge again."
Also weighing in, St. Pete Mayor Rick Kreisman. His city is one of the best in terms of mitigating the spread of COVID. 10 Tampa Bay's Angelina Salcido asked the mayor what he thought of the CDC's announcement.
Right now, our numbers are going in the right direction.
And city officials are hoping that continues.
It's still a chance that people can still get COVID if you have been vaccinated.
City Councilwoman Lisa Wheeler-Bauman was against the city's emergency order expiring. But even with the order, virtually no restrictions to mitigate the virus were possible.
Based on the governor's order from a week or so ago, mask mandates went away, social distancing went away.
Mayor Rick Kreisman says the city continues to see an infection rate below 5%. He hopes new guidance from the CDC will help encourage more people to get the vaccine.
I hope it's an incentive for people and they recognize, look, the quickest way to safely put my mask away is to get a vaccination.
There's no mask mandate in St. Pete, but Kreisman says businesses can still enforce the rule if they choose.
For the most part, people are doing things, as we call it, the St. Pete way. They are wearing a mask when they're indoors. Now, this new guidance just came out today, and that may change things a little bit.
Eating areas like this in city parking spots are making it easier for businesses to open up safely. But after all restrictions were lifted, businesses now have to file for permits that could last up to 6 months. Now, St. Pete City Council are looking into a more permanent solution if they find businesses would like to keep this open as an option.
The CDC guidance also puts a lot of pressure on businesses. That's because many are deciding their mask policies based on whether their employees have been vaccinated. But in Florida, employers can't ask you for proof of vaccination. So we spoke with Dr. Marissa Levine, a public health expert from USF that serves on the board of the National Safety Council, a nonprofit safety advocate that focuses on the workplace. Now, she gave us a sharper insight on how some businesses will choose to pursue safety around vaccines in the near future.
You know, we're in a time where you can't require vaccination for employment, but if your employment requires you to be in a space, the businesses can require it in the space. So that means that you might not be, if you're not vaccinated, you might not be able to work in that space yet. You might have to stay home, for example. But each business has to figure this out and make sure that they're legally compliant. We're also in a situation where the vaccine is not yet fully approved by FDA. It's under emergency use authorization, which makes any kind of vaccine mandates tough.
Dr. Levine is also hoping that the CDC will step up and help direct businesses in the same way they directed healthcare organizations on operating at the height of this pandemic.